Hello and welcome. Today, we'll be exploring a relatively uncommon yet significant condition affecting the urinary system, bladder leukoplakia. This video will provide a comprehensive overview, covering its mechanisms, symptoms, diagnosis, and management. We'll also touch upon recent research and preventive measures. The exact cause of bladder leukoplakia remains somewhat unclear, but chronic irritation and inflammation of the bladder lining are believed to be the primary drivers. These irritants can range from long-term infections, such as chronic cystitis, to bladder stones that continuously rub against the bladder wall. In some cases, catheterization over extended periods has also been implicated. The persistent irritation triggers a metaplastic change, where the normal urothelial cells are replaced by stratified squamous epithelium, a more durable but abnormal cell type for the bladder. Pathophysiologically, bladder leukoplakia involves a process called squamous metaplasia. The normal transitional epithelium or urothelium, which lines the bladder, is replaced by stratified squamous epithelium. This change is a protective response to chronic irritation. The squamous epithelium is more resistant to damage from irritants, but it also loses some of the bladder's essential functions, such as its ability to stretch and contract effectively. This metaplastic change can lead to thickening of the bladder wall and potentially predispose the bladder to other complications, including infections and, in rare cases, malignant transformation. Epidemiologically, bladder leukoplakia is considered a rare condition. It is more frequently observed in individuals with a history of chronic bladder irritation or infection. Women tend to be affected more often than men, possibly due to the higher incidence of urinary tract infections in women. The precise prevalence is difficult to determine due to the often asymptomatic nature of the condition and the lack of large-scale population studies. Many individuals with bladder leukoplakia experience no noticeable symptoms, particularly in the early stages. However, as the condition progresses, symptoms can develop. These may include frequent urination, a persistent urge to urinate, pain or burning sensation during urination, known as dysuria, and blood in the urine, or hematuria. Pelvic pain or discomfort can also occur. The severity of these symptoms often correlates with the extent of the leukoplakia and any associated complications, such as secondary infections. Diagnosing bladder leukoplakia typically involves a combination of methods. A thorough medical history and physical examination are essential first steps. Urinalysis is performed to check for infection, blood, or abnormal cells. Cystoscopy, a procedure involving the insertion of a thin, flexible tube with a camera into the bladder, allows direct visualization of the bladder lining and is crucial for identifying the characteristic white plaques of leukoplakia. Biopsies taken during cystoscopy are then examined under a microscope to confirm the diagnosis and rule out other conditions, such as bladder cancer. While leukoplakia itself doesn't have distinct types, it is often classified based on its extent and the presence or absence of associated conditions. For instance, it can be described as localized or diffuse, depending on how much of the bladder lining is affected. Furthermore, it may be associated with chronic cystitis, bladder stones, or other urinary tract abnormalities, which can influence the management approach. The treatment of bladder leukoplakia focuses on addressing the underlying causes and managing the symptoms. If a chronic infection is present, antibiotics are prescribed. Bladder stones, if present, are removed surgically or through other minimally invasive techniques. In some cases, procedures like fulguration, which uses an electric current to destroy the affected tissue, or laser ablation may be used to remove the leukoplakia plaques. Regular monitoring with cystoscopy is important to detect any recurrence or progression. Unfortunately, there's no guaranteed way to completely prevent bladder leukoplakia. However, several measures can significantly reduce the risk. Maintaining good hydration, practicing proper hygiene to prevent urinary tract infections, and promptly treating any bladder infections are crucial steps. Avoiding prolonged catheterization whenever possible and addressing any underlying bladder conditions, such as bladder stones, can also help minimize the risk of developing chronic bladder irritation and subsequent metaplasia. The prognosis for bladder leukoplakia varies depending on the extent of the condition and the presence of any complications. In many cases, the condition can be managed effectively with treatment and lifestyle modifications. Regular follow-up and cystoscopy are essential to monitor for recurrence and to detect any signs of malignant transformation early. Recent research is exploring novel therapies, including targeted drug delivery and gene therapy, to improve treatment outcomes and prevent recurrence, but these are still in the experimental stages.